that better?
Mm-hmm.
Alright. And then under the eye, where I go next?
Mm-hmm.
So, just for your video purposes, what have you done? You've gone across the level of the thyroid cartilage, you've gone right under the border of the mandible,
Correct.
and then you've gone right under the zygoma, from the top of the ear down to the low point,
Mm-hmm.
and then following the curve of the zygoma.
Correct.
Right.
And then we're going to find that orbital rim. And the way that I like to mark this is I like to pull down on the skin and then find that orbital rim. And you're going to draw a line. Because when we treat,
Oh,
we'll
that's
have
right.
either we will pull down or we'll have the patient help us and pull
Okay.
down on their own skin. So we're getting as close to the eye as we can get.
And I want to be right on it.
Mm-hmm.
Okay. Is that good?
Yeah. And then give you a sharp one.
Thanks. All right, and then I just, talk to me about those, I don't remember.
So the next lines that we mark, we're actually going to have the patient open his eyes and just look straight up at the ceiling. And we're going to mark basically the lateral orbit from the lateral
Straight out.
canthus straight out, yes. And next we're going to have him look straight at the ceiling again, and we're going to mark the mid-pupillary line. And you can actually, I'm just going to have you do like a little notch for now. That's correct, but let's just do a little notch. So that's perfect.
Oh, just a little.
Just a little
tiny,
line,
okay.
and we'll have you mark the other mid-pupillary line.
Okay.
And we're going to mark the midpoint of the face. Good. And we're also going to find the supraorbital notch right there.
By the way, about 9 out of 10 people have.
And that's where I put my X, is that right?
Yes. That's
Okay.
exactly
Be
right.
gentle there because there's a nerve and it hurts when you push.
Okay.
Good. So now we're ready to draw our columns. What we can do is just double check symmetry, so we can just make sure that everything looks, pretty even, which looks good. This is dipping down maybe a little bit that way.
Right here at the
Mhm.
very end.
Actually this line right here. See how it kind of curves down a little?
Oh, I do. Mm-hmm.
So we can kind of just make that go straight down. There you go.
Now, are you going to start doing the vertical lines in a second?
Correct. Yeah.
And just show the camera.
Your war paint. Yeah.
I thought
Okay.
When I was a kid, I liked Indians.
Okay,
Is
that looks
everything
great.
okay?
Yeah,
All
that
right.
looks great. So now we're ready to draw our columns. And the first thing we can do is we can measure our symmetry here. So we want to make sure that we have our mid-pupillary line symmetrical on both sides.
So that's 5, 10, so it's 13. That's 12.
So you can move it out like one line.
It's a little bit medial on that, right?
This one.
Mhm. You can move it.
May I have the eraser, please?
And then once you've measured it and it's symmetrical, then you can draw it straight out to the hairline.
It's actually like right in between there, isn't it?
And let me find. Should have a protocol sheet just to remind you how many lines go where. So basically, the protocol is typically 10 lines from the mid-pupillary line laterally. So you're going to measure 5 and then 5.
Okay.
And I would put a dot at 5 too. So 5 and then another 5. Good. And then you're going to fan out those lines a little bit.
Like that?
Maybe a little less. Yeah. So basically we're making like a crescent over the brow.
Okay.
Same on the other side, 5 and then 5.
Alright, and then do you put your numbers in there for your, do you do that?
Oh, I've never done that, but you certainly could.
Yeah.
Yeah,
Is
you
that what
certainly
she-
could.
and then
So it
that's what
actually would be
typically
5
goes
and then 5, yeah.
I think especially in the beginning that would help
Yeah,
me
that's
to.
a great idea. Now, because we're treating a man, we also want to put a few medially. So on the other side of that supraorbital notch, we can put another, I would draw a line like on the other side of that
Mhm.
X. And we can put like another 4 lines medially.
Like that?
Mm-hmm.
So that's the area I don't treat. That seemed helpful the other day when
Mhm.
she.
Like 4 in that photo. Straight line.
Perfect. So the next thing we're going to do is the lateral orbit, and the normal protocol is 10. It's usually 5 above the line and 5 below the line.
Okay.
And so what I'll have you do is kind of around that area of the supraorbital rim is where I'll have you measure out 5 and 5.
Okay.
And we can put that, one of those black dotted lines right over that line.
Okay. I think I draw more on my ruler then.
Oh, that's normal, that's fine.
So.